Good morning, everyone. I'm Tanisha Sullivan. I'm head of external engagement and health equity strategy here at Santa Fe, and it is my pleasure to welcome you to our Cambridge Crossing campus. We are thrilled to once again collaborate with the Boston Globe on its second Health Equity Summit. You know, before I introduce the panel, I want to let you know that this particular session was initially designed to be a small, kind of private, before we get started conversation. But as we started to build out the session, we realized how incredibly powerful this topic is, certainly how dynamic our panelists are, and we were reminded this is all about inclusion. This is all about expanding access. And so we took the opportunity to not only invite folks to start the summit with us in person, but we've also invited a virtual audience so that as many people as possible have the opportunity to join in on this conversation. So I welcome you to Women Who Lead, the business case for health equity. Again, we have a dynamic panel of industry leaders, healthcare leaders, government leaders, just all around get stuff done leaders with us today who will be guided in their conversation by, of course, nationally recognized journalist Janet Wu. Janet, thank you so much for joining us and for helping to kick us off today.
It is my honor and pleasure. And not only is this topic powerful, it is critically important. And may I also add, thank you for inviting us into this stunning campus. It's amazing to see the incredible spaces where so much work is being done in Massachusetts. As we all know, illness is the great equalizer, impacting all races, ages, socioeconomic groups. But access to care is not equal. This morning, we are setting the stage for this summit by discussing the importance of proving that healthcare equity. And as Nisha was saying, this summit is specifically titled The Business Case for Health Equity, Women Leaders Who Are Driving the Change. And again, to my right, I have amazing leaders representing research, clinical care, business, policy, getting the hard stuff done in Massachusetts. So to my far right, State Representative Lee Davis from Western Massachusetts, representing Lenox, Great Barrington. I just learned she represents the largest district in the House. It takes quite a bit of time to drive from one end to the other. Dr. Thea James, Associate Chief Medical Officer of Boston Medical Center. I come from a medical family. I was telling her early this morning that if I experience trauma, if I fall off the ladder or whatever, I'm very clumsy, take me straight to BMC. And then we have Brooke Thompson, President and CEO of the Associated Industries of Massachusetts. Brooke has a very special position because she hears from companies all the time, every day, what's working, what's not working. And this group gets together to try to get more things to work. And Aneta Roman, President and CEO of We Are ALX, formerly Amplify Latinx, representing a group that is growing every day in Massachusetts. I'd like to begin by asking each of you to briefly explain your biggest challenge right now in the professionally in the business sector, and as you frame this in why it's so important for businesses to achieve greater health equity. And again, we'll start with you, Representative.
Sure. Well, I'm very, very grateful to be here. So as you had mentioned, I represent the largest district in terms of land mass. I represent the 3rd Berkshire District. So we have towns that range from population of 160 to 7,000. So I represent 18 towns. It takes me about an hour and a half from end to end. So that gives you a sense of the rural district nature of where I represent. So we have quite a few challenges. We have desert challenges. We have ambulance desert challenges. A lot of times you don't know if an ambulance is going to reach you. It could take 30 minutes, 40 minutes. We have childcare deserts. So there's a lack of childcare options. Mental health challenges. So we have a lot of folks that are in desperate need of mental health, peer respite services. And we have healthcare provider deserts. So in this rural population, it's very, very, very hard to find a healthcare provider. We have, highest rate of insurance in terms of the across the states, but finding a healthcare provider is a huge challenge for us. In my district, we're very grateful to have a critical access hospital, Fairview Hospital, which is federally recognized, and it's a 25-bed hospital, and it recognizes the fact that we serve underserved rural populations. So it gives you a kind of a sense of the need in rural Massachusetts where I represent.
Dr. James, you, of course, are a leader in one of the busiest hospitals, not only in Massachusetts, but in the country. So, talk to us about the challenges that you face on a day to day business trying to address all the healthcare needs.
Sure. As you know, I work at Boston Medical Center, and in some ways, I feel like we have really yet to recover from the pandemic in so many ways. I mean, there are finance issues, there are vacancies and jobs not being filled, there is capacity issues. And I see something unprecedented in my career, I would say, like in the emergency department, the volume is so high. I mean, the number of patients that show up every single day, 400 plus people, um, e- um, pretty much every single day, and in many ways the high 300s as well. And so, what that translates into, and trying to understand what are the nuances, that are driving that. And I say that because Massachusetts, another something else that's unprecedented, more than 94% of our residents have health insurance, and we still have these issues. So there are some nuances, that we have to like dig a little deeper to do. So BMC is doing what it does, its commitment and mission to provide excellent care to everyone who comes in the doors every single day, and to also provide care for their communities.
Brooke, of course, businesses are always telling you about the challenges of the expense of healthcare. What are you hearing?
Sure. So at AIM, we're a statewide business organization. So we represent businesses from Berkshire to Boston. So we represent businesses in the representatives district all the way to the businesses here where we are today. And we have 3,400 members. The majority of our members are actually small and medium-sized businesses. And so, as you say, a lot of them are struggling with cost. But the number one challenge right now that is universal and that is industry agnostic is a competition for workforce and talent. And that has never been more true than today. It was true before COVID, but it was drastically exacerbated by COVID. And you can look at a lot of the things that came about as a result of COVID, right? Now the way we work and the way we interact with our employer is different. There's a lot more hybrid work. There's a lot more remote work. We can draw from talent from states that we weren't drawing from before. And so, businesses have to be more competitive. And so when you're in a high cost state and you're looking at challenges like transportation, like energy costs, like housing, and all of those impact access to healthcare, you really then see that impact the workforce. And so for businesses, there is a real impact on talent and workforce directly related to healthcare, and so it's all wound together, and it's something we hear daily from our businesses throughout the state.
Anita, we were talking earlier that you hear stories from individuals about the challenges of healthcare costs, how it impacts businesses, and also how it impacts families, whole families, and communities.
Thank you so much, Janet. Well, similar to Brooke, we focus on businesses and individuals. We're a business organization, and We Are ALX stands for We Are Amplifying Latino Excellence, because for far too long, there have been narratives about Latinos that have been not the most positive. And the reality is there are still many opportunity gaps that need to be filled, and that's where we come in. We support businesses to grow and scale. We partner with organizations like AIM to support them with their access to procurement opportunities and general visibility across the board. But at the end of the day, we always say that economic development is a social determinant of health, right? And that is really powerful because when you have to worry about putting food on the table, then other things fall to the side and go to the back burner, right? And so for us, it's really important to actually maximize and galvanize the community to understand that they have the opportunity to be part of this knowledge economy that we have here in Massachusetts so that they can be those employees that can take those jobs. And there's an incredible opportunity because we actually just released a report with MTF that demonstrates that 75% of all Latinos in Massachusetts are under 45. So that is the current and the future workforce. 25% of all children between 7 and 18 are Latinos in Massachusetts. So think about that, right? And then of course our employers and our businesses, we want to make sure that they're equipped with the necessary skills to thrive and to succeed. And that's why we support them. Particularly, we have different verticals, and I see someone here who is in the same space in childcare, and I know that we have other friends in the room who care a lot about that because a lot of Latinas are in the childcare space, right? And so they're business owners. So we support them to not just grow and build wealth for themselves, for their families, and for their communities, but also to create jobs, right? And to continue expanding because employers need childcare. That's part of healthcare. That's part of health. Excuse me. So it's just this very symbiotic and virtuous circle that we all work on to make sure that we are advancing the state's competitiveness.
So, as we're thinking about the challenges of acquiring talent and the shortage in workforce talent, while also thinking about the future workforce, I want to ask a question. Any one of you can jump in. And it's a pretty simple question. Beyond the line item expense, why should businesses care more, invest more in healthcare equity?
I'm happy to jump in first. So it is a business imperative because it directly relates healthcare access, healthcare outcomes is the infrastructure of your business if you are an employer. So you can look at everything from if you're an employer, I say this all the time, right? What are you thinking about? You're talking about return on investment, right? Your employees are your infrastructure, their ability to come to work, to show up, to be productive, right? And if you want to you want to take that down and manifest it into, okay, they're happy, they're not missing time, they're productive, their mental health is good, right? And this applies to them, but it also applies to their family. Again, Anita brought up very appropriately, your employees are caregivers, right? They are caregivers for their family, for their parents, for their children, whatever that may be. So this is systemic within the family unit. And that is really that is your biggest investment as an employer, is your talent. Again, going back to what I said before, the most expensive thing an employer can do is go out, try to hire, try to recruit, and then train someone. So what we need in a time when and every year at AIM, we have an HR solutions practice within our business. And so we go out and we survey. Without fail, 20% of all employers, again, across all industries, have open positions. Okay, so think where the unemployment numbers are. That means they still can't fill positions, right? So you don't want to lose people. So it is an imperative for businesses to hold on to people. If people are sick, if their kids are sick, if they can't get access to health care, if they're getting access but not in the right way, right? As Dr. James said, if they're going to the emergency room but they're not getting the right care, or they're waiting in line, right? So they're missing a lot of days. That is a direct impact on employers' bottom line. And I don't like talking about it that way, but if you have to talk about it in a return on investment standpoint, that is why it is a business imperative. And in a competitive economy, again, that's why we have to really get our businesses involved.
It's funny you talk about return on investment and the ROI. And I know that Dr. James, you have a lot of data that backs this up. The Blue Cross Blue Shield survey that shows how costly it is when we don't have healthcare equity.
Yes, almost 2 years to the date, I guess I would say. Blue Cross Blue Shield Foundation was commissioned to do a study and culminated in a report in collaboration with the Health Equity Compact. And they were looking to quantify the impact or the burden of inequities, on the Commonwealth. And three things, and the number is $5.9 billion annually, and so what is included in that $5.9 billion is avoidable spend, much to what you were just talking about, Brooke. Also, low labor productivity for people, again, what you were highlighting, people not being able to work out of the workforce or in the workforce, and because they're not totally well, not, fully productive, and also premature death. And premature death also added to that from the perspective of whether it's on the early end of life or the later end of life, how many years of lost productivity happens, and how many families are not built fully, and how many people are not able to contribute to society and the economy and the Massachusetts state overall, as well as to the Massachusetts economy. And it's sort of like it impacts everyone. It impacts employers, of course, but it also impacts public and private payers, because as the cost of taking care of people, the cost of health goes up, the premiums go up, and then that circles right back to the employees who have to, take care of people in that way. And it's just like a vicious cycle. So it absolutely has a quantifiable impact or burden on the Commonwealth.
And
Representative Davis, I know you're about to speak, and I want to ask you something that plays off of this, because we do have some geographical inequity as we're talking about. We talk about our hospitals being ranked so high, BMC, MGH, Brigham and Women's, but those global rankings are always in Boston. And as you were talking about the challenges of being in a rural area where you don't have those hospitals, you have the 25-bed hospital. So I want you to talk a little bit about that, but also something else. When we talk about industry in Massachusetts, often we think about our incredible, famous, prominent companies. We are in one right now that are large, but your district has a lot of small businesses, which I would think exacerbates the problem of health inequity when it comes to businesses. So I know I'm throwing a lot at you, but
sure.
please.
First, to take off from the premature death rate, Berkshire County has the highest premature death rate across the Commonwealth. So that's number one. We also are one of the highest suicides rates across the Commonwealth. And um, as I mentioned, coming off what you said, a happy employee is a productive employee, and we really need to look out for those that are the caretakers, that are the breadwinners. In my case, I'm a single parent to three children, and I moved here from Ireland, and they're 3, 5, and 7. So I had to find a way to support my children and send them to school and be the breadwinner. So what I did was I started an errand service business so that I could, really work in the time with my kids and have my youngest in the car while I was doing errands for others. But coming off your point, we have broadband issues, for instance, in Western Massachusetts. We have parts of when you're driving through Western Mass, you just lose cell service. So it's very, very hard for us to set up telehealth. It's very, very hard for us to look at digital equity and realize that you might miss an appointment because you have spotty cell service or you can't get online. These are real issues. Transportation is a huge issue too. So we have regional transit authority, but that doesn't really work in all cases. So we're looking at microtransit, and a lot of these folks are older in Western Mass, and they depend on this microtransit program to bring them to doctor's appointments, to connect them to healthy, affordable local food. So when you think about the health outcomes in rural Mass, it's less about the doctor's visits, but more about what's your home environment, what's your environment at work, what's your childcare situation. Do you feel safe in your house? So these are our health outcomes in rural Mass.
So yes, what I'll add is that, I mean, I agreed with everything that's been said, but when you have 1 of 5 of your potential employees that is a person of color that cannot access health, cannot access, transportation, doesn't have access to broadband, that is a huge issue, right? And so it affects everybody. And in Boston, I know that the difference, and the doctor will be able to share the number more precisely, but there's a huge disparity in age in the years that you get to live on this earth based on your zip code, right? Because if you are in Roxbury or Mattapan, you live, I think, 20 years less, I think 23,
23 years.
23 years less than if your zip code is in the Back Bay, right? And that is just incredibly tragic, right? To think that we do have access to healthcare, right? Because we have the health system and the reforms here in Massachusetts, but people are not necessarily accessing the healthcare because of other elements, other socioeconomic elements that affect their ability to lead a productive life. And, and again, it just goes back to the competitiveness of Massachusetts. And we want to make sure that Massachusetts stays competitive so people stay here, so they take these jobs because we need employees, we need workers here.
And can I just add one thing? And this is, a separate conversation about whether this is how it should be structured. But let's remember, for the way it is set up now, an employee or a person intersects with their health insurance through a job, right? So again, your relationship to health insurance, which we're really lucky where our numbers are in Massachusetts, is through your employment. So again, that connection, there is an inherent connection there through your employment. And again, but then if you drill down, when we're talking about inequities, the people that are in that really small percentage, they are primarily male, right? Primarily people of color and primarily people 300% below poverty, I believe. So again, they're unemployed. So we have to look at why the inequities are where they are, and then the people that are connected to it are connected to jobs. So there is a role there for businesses.
I just wanted to add one more thing in terms of what's possible in the healthcare sector. I mean, our job is to take care of people and provide excellent care for them every time they present to us. And some people might say this is outside of healthcare's lane, but to do anything beyond that. But we actually can't do what we're there to do if other things aren't addressed in meeting patients' priorities. And sometimes I call it creating and capturing value because we all make decisions based upon priorities and what the value is. Even me, I have a health care appointment. I'm going to measure it against what I something I might have to do at work or whatever. But people are also doing this in terms of based upon resources that they might have, and it's a no-brainer for folks where they're going to allocate their resources. If it's do they spend it on eating healthy or coming to a health appointment, or do they spend it on, as you were speaking to, taking care of their families, paying rent and that type thing. And so we have to have like public-private, partnerships as well with people outside the hospital to address the things that matter most to people. So if we have a value proposition that's limited to taking your medications, coming to your appointments, eating well, these type things, versus offering them an opportunity to have a job or increase their economic status, improve that, where they can then prioritize health, that also helps to reduce the cost and the burden that we're seeing as well. So we have to sort of have a sort of full-on approach when we're doing this. And the patients themselves, actually, we give them an opportunity. You can give them an opportunity to tell you how to prioritize things for them.
That's such a great point, Dr. James. And if you're in a job, does your job allow you to take that time off from work to take your child to the doctor, to have your appointment? And let's also admit it's easier in some professions if you're a shift worker, right? Or if you're in the healthcare field yourself, right? What are the challenges there? And so a lot of what we've done at AIM is said, in particular, if you want to be competitive and you want to hold on to those employees, because we've heard the number 3 reason people leave a job is because they have these type of issues with caregiving, right? Or being able to meet these caregiving needs. Find a way, right? Whatever it is, it doesn't have to be the same as everybody else, but find a way, because you're right. People will make decisions based off of their own priorities.
Yeah, and to jump on that, a parent shouldn't have to choose between feeding a child and filling their prescription, right? But these are, the hard choices that many of us feel on a daily basis. And talking about inequity, what's happening in Western Mass is it's quite hard, difficult for some healthcare providers to make it, having Medicare and Medicaid reimbursement. So you're seeing some of the healthcare providers go into a concierge service that, they'll work, for quite a lot of money or cash. And those are taking some of the healthcare providers out of the circuit for us that, really depend on Medicaid, Medicare. And we also, what we find in Western Mass is we're a seasonal community designation. So our population surges in the summer. So we get, an influx of older population coming and needing help in our hospitals. And that has a push down effect on those that live there full time. So we're really, interesting pressure points all around.
I would also add that we don't want to forget about mental health, right? Because that's also a huge issue. And Dr. James mentioned it earlier, right? We're still not done with the impacts of COVID, right? And that affected many people in our communities. And so the fact that you have to choose between one thing or the other affects you, right? And so there's many other implications that just continue this cycle that we want to make sure that we remove by focusing on health equity.
Speaking of the pandemic and COVID, that really brought into sharp focus the health inequities nationally and even in our own state. I'm wondering if any of you can offer up some of the lessons that that pandemic taught us as we still continue to recover from it business wise.
Yeah, I can speak in terms of Western Mass, and COVID really revealed gaps in telehealth and broadband. How we really rely on having options to maintaining our health. So what in 2020 there was a Digital Equity Alliance formed, and Bay State Health, we were very grateful to receive, I think, a $5.1 million grant to help Western Mass towns bring up to level and have this sense of digital equity for our population. So access to broadband, teaching what it's like to go and depend on telehealth, really opening it up to populations that are underserved. So we've been working very hard with partners across the community to make sure that they are feeling empowered. How do you use a portal, a patient portal? How do you making sure that towns have access to broadband or they have the funds? So unfortunately, COVID really shined the light on this inequity from a digital point of view.
Dr. James can speak to this more than I can, but because AIM represents hospitals, we represent the life sciences industry. I think COVID shined a light on what a fantastic resource Massachusetts has by being this center of innovation, right? But also what stress COVID caused on our economy. So we have the best hospitals anywhere. We have these hospitals that then work in direct cooperation with these amazing life sciences companies that led to the innovations that literally gave us these cures, these vaccinations in record time, right? But they also suffered immensely, not just financially, but look at what happened to the workforce, right? These healthcare workers, these doctors, these nurses, every center of the workforce were taxed, right? Talk about mental health load, right? And it has still, they have not recovered, and they are part of an ecosystem. Then let's not even begin to talk about our educational system that also brings in, right, the students that feed into the hospitals, that feed into the innovation in our life sciences. And so they're under a serious stress right now that also makes it really important for Massachusetts to have a strong economy that goes to all of our other industries that you may not see every single day. And so that has me concerned about our overall economy, our overall workforce. And I think we all have an obligation to lean in and support those three industries that right now are struggling and have not fully recovered from COVID.
So I'll touch upon two details. First, the small business community, which was incredibly impacted because they didn't necessarily have access to the tools to apply for the PPP loans and all these other resources that were available. So we see a huge disparity between the larger businesses that had the teams that could support, and then the smaller organizations, the smaller businesses that maybe weren't as formally structured, right? And so that created a bigger gap. So that's where, of course, Amplify actually stepped in to support these businesses because we didn't do technical assistance before 2020, but we saw the need and we're like, oh my God, we have to do this. Otherwise, these businesses are going to fold. And these businesses are employing people in local communities and they're keeping the money in their communities and they're investing and reinvesting. So it's important that these businesses are supported. And the second thing I'll say that we've kind of mentioned already is around care, right? Because we saw how many women had to leave the workforce because of lack of childcare, right? And so that is still to this day an issue. And so that's why, again, it's like, we're harping on the same issue, but childcare is incredibly important. And not just childcare, also elder care, right? Because a lot of us are in that sandwich generation where we're supporting not just our parents and caring for them, but also children in our homes and our families. So that at the end of the day impacts productivity, impacts the ROI, impacts business, and we want to make sure that business leaders that we're aware that these are needs that need to be filled.
Brooke pointed out something that we all know that makes us lucky here, that we do have great institutions, we have great businesses, we have great hospitals, we have a lot of smart people. So I want to ask you, what is giving you hope right now? Some of the lessons that did come out of the pandemic and innovations. So at the intersection of innovation, technology, and this goal of achieving greater health equity, what is giving you optimism?
I can start. So we have an issue with emergency medical services in Western Mass and rural Massachusetts. And so what came out of COVID was a feeling that we couldn't wait for the legislature to solve it for us. So we were as part of a task force that looked into regionalization of services, of emergency medical services. So within the 3rd Berkshire District, our 18 towns, we came together and we said, we need to solve this problem. So we were very grateful to have received a grant from the Collins Institute, or that's being administered by the Collins Institute, to look at a feasibility study on what would regionalization of emergency medical services look like. Because as I mentioned, especially in rural Mass, you can wait 30 minutes, 40 minutes for an ambulance. And it's very, very fractured. There's not a sustainable funding source right now. And from my point of view as a legislator, I looked at filing 5 bills just to help really bring up and modernize and fund the emergency medical services. But it gave me great hope to see 18 towns join together and say, we're going to try to solve this. So we have this feasibility study in process and we are addressing this.
I think what gives me hope, I mean, first of all, by nature, I'm an optimist, but it's also not unfounded. And so I've lived long enough to see a lot of things we've gone through, and I feel like, we just continue to keep going and we land, just fine. I will also say, though, at BMC during the pandemic, we learned a lot. And one of the things we've learned is um, the most important voice in this space is the people who are suffering most and need the most help. We have learned that they know what is best for them and what they need to not just survive, but to thrive, and what the barriers are that have prevented them from doing that. And um, we have benefited from us being partners with those people in creating solutions. And we have data and outcomes to prove that we have closed several gaps. And I think what we have learned has been invaluable to us and will continue to be so.
What gives me hope is that, we're sitting here talking about reaching health equity, and we know that we can't get there without addressing other systematic inequities that sort of get us here, right? And so there's a lot, but 2 really big ones that are impacting us here in Massachusetts that I spoke about before, right, are housing and economic inequities. And so I have hope because we live in Massachusetts and we have, and kudos to the representative, we have a legislature and a governor who are laser focused on this and who have just within the last session passed monumental housing and economic development legislation focused on building more affordable housing, on passing economic development legislation that grows jobs, that gets housing built, that does the things that we need to do again to address the inequities that also lead to these health inequities, because we can't just address one thing and expect there to be these outcome changes. And so that is why I am hopeful and I'm grateful that we're in Massachusetts.
Absolutely. I echo what my co-presenters just shared because, again, I'm also naturally optimistic. I always see glass half full, not empty. But I am hopeful precisely because of that, because we have an administration that cares. We have an administration that cares about pay equity. We have an administration that cares about childcare, about housing, legislators that pass these bills that, that put forward this progress, right? So there's only room for improvement. And I believe that if we close those opportunity gaps, we have college, we have free access to college for any young person that wants to go, and not so young, anybody really, that wants to go to the UMass system or, one of the community colleges to acquire the necessary skills to take the jobs that we have available and that are good paying jobs and that can move forward the economy so that we can have more health equity. So again, there's only room for improvement.
I have to say, for Dr. James to be on the front lines of a major city hospital, to be optimistic is a superpower. We are under our last 3 minutes, and I just want to quickly ask you if you can give us a little bit of a view into the future. These are tough problems. They're going to need tough solutions. Are there any changes that you're seeing, any innovations, any things that companies are doing in order to achieve this greater health access parity?
Again, we are looking really to regionalization, excuse me, and shared services. Having 18 towns and having such disparate towns and being parochial in many natures, silos. So we're talking about, 18 fire departments, 18 police departments, and so forth. So we're realizing that we need to come together and, share our services and, partner and figure out, how can we really raise ourselves up, and this optimism that you talk about. I sense a feeling of optimism, especially, and I think we're creating new opportunities for partnerships. So that's what I see in Western Mass.
And again, I see the partnerships as well, enabling people to address what matters most to them, in enabling people to change their socioeconomic lanes. I do think that the economic piece is really, really key, in so many ways, because it's not just what works for that person and their family, but what it enables them to do to contribute to the aggregate economy, and how that impacts everything from carve outs to decreasing the amount of money needed for subsidies versus people being able to contribute and need less in that way. So I think it helps the entire economy and health overall.
Yeah, and I do see employers recognizing that both providing education and support where they can, and I think educating themselves, right? And listen, I say this all the time, particularly our small businesses. They're busy running their businesses, right? They're not, for the most part, they don't have bad intent in this space. They're busy running their businesses, but they're doing a better job, and we can support them by providing them tools about how they can educate their employees to make better choices, and how they can support their employees by giving them more time off to do what they need to do to have better health outcomes. So I think they are looking at it as a competitive advantage, and so that is really a positive step.
So at Amplify, or ALEX, our focus is on normalizing the fact that Latinos are an economic engine in Massachusetts. And we've been able to partner with industry leaders like AIM, like Mass Business Roundtable, like, like all the major business groups in Massachusetts, to make sure that we are driving this conversation and that we're moving forward the opportunities to work in coalition so that we can advance the job opportunities, and again, at the end of the day, the health equities for the entire state.
I love the partnership. I love the cooperation on this panel today. Thank you so much, State Representative Davis, Dr. James. I know you're probably going to go back to work saving the city. Brooke Thompson, making sure our companies are healthy. And Ada Roman, thank you so much for doing your part to achieve greater health equity. Indeed, women leaders who are driving the change. That is our time. You have a 15-minute break. The full program begins at 10 a.m., and I know it's going to be a spectacular day. Thank you so much. It's right here. It's right here. on the chair.